Hey there, how are you? My name is Francisco, and I will be doing your HIV test today.
Hello, my name is Dwayne. It's nice to meet you.
I wanted to take a couple of minutes to talk to you about the test and what we're going to be doing today. Is that all right?
Sure, sounds good.
So the test that we'll be doing today takes around 20 minutes to develop. And while it's developing, we'll have a chance to talk a bit about HIV and why you came in today. The complete session should take somewhere between 30 and 40 minutes, and then you'll walk out of here with the result. Sound good?
Yeah, that sounds good. I'm ready to know my result.
So the rapid test we use here is done by collecting a small dot of blood from your finger. So what I'm going to do is I'm going to prick your finger and place a drop of blood into the test. It'll feel like a small pinch on your finger. Are you okay with that?
That's fine. I'm not grossed out by blood.
Great, thanks. There are two results you can receive today. The first is negative. This means that the test did not detect HIV infection. The other result is positive. This means that HIV infection was detected. In the event that somebody does test positive, we would ask that person to visit a clinic to be tested again. Does this make sense?
Yeah.
In rare cases, the test is invalid, in which case we'll collect another drop of blood from you and run the test again. I know I just said a mouthful. What questions do you have for me about any of that?
None at this point. I think I got it.
Another thing I need to mention is that if the test comes back negative, depending on when the last time you may have been exposed to HIV, we may recommend that you come back to test again. But we can talk more about this while the test is developing.
Okay, sure.
So unless you have any other questions, I'm going to ask you to sign here, which tells us that you give us permission to test you and that I explained all this stuff to you. Here's a pen.
Okay.
Cool, thank you. And here is actually a pamphlet with a bit more information about the test that we're going to be doing today. If you're ready, let's go ahead and get started.
Okay, sounds good.
So while your test is developing, let's talk about what brought you in to be tested for HIV today.
Well, this past weekend, I met a guy online, and we ended up hooking up. We used condoms at first, but then we didn't. So I'm a bit nervous and just want to make sure I'm okay.
Yeah, I hear you. So you met a guy online, ended up having sex with him. Sometimes you guys use condoms, sometimes you didn't, and you want to check in around your health. Have you tested in the past?
Yeah, a few times.
Okay. Do you remember when was the last test you had?
Probably 6 months or so. I'm not always the best at using condoms. So I try to get tested at least twice a year.
That's great that you recognize the importance of getting tested and knowing your status. Could you tell me what you know about how HIV is transmitted?
Well, I guess I know the basics. People can get it from having sex or getting high.
Exactly. Do you mind if I add a bit to what you just mentioned?
Sure, go ahead. That would probably help me.
You're totally right. When people have certain kinds of sex with people who have HIV, and blood, semen, pre-cum, rectal fluids, and vaginal fluids are exchanged, it's possible for that person to become exposed and infected with HIV. And yes, drugs do play a role in HIV transmission. When people use needles to inject drugs, and if they share those needles with someone who has HIV, they can also be sharing blood in the needle. What questions do you have about any of that?
So if I have sex with someone and they come inside of me, then I might become infected, right?
That's correct. Remember earlier, I mentioned if you had been recently exposed to HIV, we would need to get you retested?
Yeah, is this the case with me?
Yes. Our test today would likely not pick up an infection as recent as last weekend. It's still a good idea to get your result today to rule out infection from a previous exposure. Does this make sense?
Yes, that makes sense.
If your result comes back negative, we can talk about a time for you to come and get tested again. Could you tell me the day you last had sex without a condom?
Okay, I guess I can come back in. The last time I had sex without a condom was 2 days ago.
Okay. I want to talk to you about something called PEP. What do you know about it?
Do you mean PrEP?
They do sound similar. PrEP is HIV medicine that people take before possible risk behavior to prevent HIV. PEP is actually the opposite. It's the medicine that people can take right after a possible exposure. if they think they may have been exposed to HIV. Because it sounds like you were possibly exposed 2 days ago, if your result comes back negative, I can give you some info about a site where you can get PEP, and we can discuss more options about PrEP.
How involved is PEP, and where would I even get it?
You know, people who qualify for PEP will be given some medicine to take daily for 28 days. The tricky thing is, it has to be started within 72 hours, so basically 3 days after the exposure. So if your test result is negative, we'll want you to get linked up to a place that prescribes PEP today. Probably the best place to get PEP is at your local emergency room. You know, I also heard you say that you guys didn't use condoms, and that was something that concerned you. How often does that happen?
Yeah, that's true. I wish I could tell you it was the first time, but that would be a lie. I've never been very good at using condoms.
Yeah, you know, many guys tell me about having trouble using a condom every time they have sex. We can talk more about options like PrEP after we get your result. You know, you made an important decision to get tested today. It really shows that you care a lot about yourself and those around you. We just have a few more minutes. Let me know if you want to discuss anything else. Otherwise, just hang tight and we'll have your results in a few minutes.
Okay, that sounds good. It sounds like I have some options, and it's helpful to know about retesting. So thank you.
Hey there, I have your result.
Okay.
Your test result came back positive.
Wait, what? Are you sure?
Yeah, the test is it's a highly accurate test. So it's very likely that you're living with HIV.
Whoa.
You know, a lot of people feel stunned when they hear that their test result is positive. One thing many of my clients have told me is helpful in these moments is to think about sort of what happens next. Would it be okay for us to just spend a few minutes talking about next steps for you?
Yes, I guess. I'm shocked.
Well, right this minute, you don't have to do anything. We can sit together for as long as you feel like you need. You know, before you leave today though, I'll make sure that you have some resources so that when you are ready, you have options. You know, people live long, healthy lives with HIV. And one of the things that helps them do this is having access to medical care, a medical provider, someone who understands HIV. Do you have a doctor that you see?
No, I'd rather go to the doctor. I've got a job, but I don't have health insurance.
You know, we have someone here who spends time with folks looking at these kinds of situations to see what's available in terms of financial support for medical care. She's very knowledgeable and can help you.
That would be helpful. I'm not really sure where to begin.
Yeah, many times people who test positive have people that they want to inform about their result or people that they want to have tested. We also have a service here that helps with that. The process is completely confidential, meaning we can contact them without them knowing your information. And I know we've talked about a lot. What questions do you have for me?
This is a lot. I guess I'm feeling overwhelmed. I want to do the right thing. I hear what you're saying. I just need some more time to figure this all out.
I understand. Let's just take it one step at a time. What were your plans for the rest of the day?
I was going to meet a friend.
Well, tell me about your friend. What would it be like to talk to him about your result?
Well, he's a good guy. We've been friends a long time. Been through a lot together. I'm not sure though.
Well, he might be someone who can help you through this difficult time.
Yeah. I also have my buddy who suggested I come here to test today. He'll really want to know what happened.
It sounds like you have a few people in your life who care about you and will be supportive and helpful.
Yeah, I'll think about it.
That makes sense. So, in addition to connecting you with someone who can help you with the medical financial support, the other next step is connecting you with a doctor who knows about HIV. They'll give you another test to confirm your result today and start addressing your health needs.
Okay,
And in the meantime, can you think about someone in your life whom you trust or, who can help you and support you? If you like, we also have resources here. We have trained folks and people who are living with HIV that get together to just talk about their experiences. Here's some information about those for you. Also, I have some more condoms for you so that you can keep yourself and your partner safe from HIV and other STDs.
Yeah, that will be helpful. I just can't commit to anything right now. Maybe I'll follow up with this later once all this really sinks in.
Yeah, this is a lot to hear right now. Before we're done, we'd like to be able to stay in contact with you to make sure that you're getting what you need. Once you and our staff have figured out the medical care part of things, we can, help you keep appointments, manage next steps. How does that sound?
Yeah, I appreciate it. That sounds like a good idea. It's helpful to know you guys can support me. Thanks.
Well, I'm glad you feel this way. What other questions do you have for me?
Do you know if there are HIV doctors in the area?
I have a list of places nearby that provide HIV care. Let's walk down the hallway to the lady I was telling you about who's going to be able to help you with the financial assistance. I'm also going to get you a copy of my card and a few other things to read when you're ready. You've done a courageous thing getting tested today. Please let me know if we can support you any further.
Okay, thanks. I really appreciate your help.